Dear viewers, in leg aesthetics, the aesthetic corrections we essentially perform or the deformities we encounter often involve the leg being bow-shaped or crooked. This is a common issue we face. Apart from this, we also encounter problems such as the leg being too thin or too thick. To be honest, we do face these issues as well. Here I aim to enlighten you a bit on how to correct the bow-shaped curvature in the leg, that is the crooked leg deformity. I will try to explain. Basically, we can perform aesthetic correction for the bow-shaped crooked leg appearance using two methods. The first of these is the use of silicone implants, while another method is fat injection. Essentially, in cases where the deformity is minimal, or in cases where the leg appears slightly thin along with some curvature, I prefer to opt for fat injection more frequently. However, in cases where the deformity is very pronounced, we need to use silicone implants to achieve a clear solution. Yet, in some cases, by combining silicone implants with fat injection, we can achieve more aesthetically pleasing results in terms of overall harmony. Therefore, I want you to know that your examination findings are very important in the correction of bow leg aesthetics in any case. Especially in patients where we perform fat injection, we primarily address the issue of leg curvature or thinness, while also eliminating any abnormal localized fat accumulation in the body. Our surgery duration is on average between half an hour to 45 minutes, sometimes around an hour. You can even be discharged on the same day. In the use of silicone prostheses, depending on the patient's preference, we can perform it with spinal anesthesia, numbing from the waist, or with general anesthesia. We can perform it. Our surgery duration is on average 40 to 45 minutes, and we insert the silicone prosthesis through the back of the knee, from the knee's fold area, under the muscle fascia, or into the muscle tissue. Here, especially the key point of this surgery is that during the operation, to ensure the patient's comfort post-surgery when coming to the hospital, I always ask my patients to come with heeled slippers or heeled shoes. Especially during our first mobilization after surgery, our first movement, and when we start walking, we can be very comfortable even with a short heeled slipper or shoe. Of course, the silicone implants we use here, sometimes our patients ask, are silicone implants that will be used for a lifetime. Therefore, you will be able to live happily and contentedly with this for a lifetime. Approximately 2 weeks after your surgery, you will be able to start exercising and engaging in sports as you wish. To achieve the final form, that is, for the prosthesis to fully reflect and for your leg to appear aesthetically perfect, it takes an average of 3 weeks. We need a period of about 6 to 7 weeks. Because as the muscle fascia gradually relaxes, the silicone prosthesis will become more clearly. We will see its effect and benefit. When we look at it fundamentally, I can say that it is a very easy surgery. I can say that its effect and benefit are very clear. Unfortunately, since it is not a well-known surgery, both my colleagues and patients have some concerns, especially in leg aesthetics. However, I sincerely want to assure you that there is no need to be afraid.